This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Abhijit Loreng. The headlines. Prime Minister Narendra Modi discusses strategy against COVID-19 pandemic with chief ministers. Several states request extending lockdown for 2 more weeks. Jaan bhi, jahan bhi is the motto of government in the fight against COVID-19, says Prime Minister. Adequate supplies of essential items available to citizens, assures Prime Minister, talks tough on black marketing and hoarding. Around 32 crore people receive benefits under Pradhan Mantri Garib Kalyan package. Government sets up 586 dedicated COVID-19 hospitals with capacity of more than 1 lakh isolation beds. And Centre asks states to provide police security to doctors and other medical staff. Prime Minister Narendra Modi spoke to chief ministers via video conferencing about the strategy to tackle COVID-19. Several states requested the Prime Minister to extend the lockdown for 2 more weeks. Prime Minister said that there seems to be a consensus amongst the states on extension of lockdown by another 2 weeks. He said our fight against coronavirus will be strengthened as long as every citizen of the country fulfills responsibilities and follows lockdown instructions. The Prime Minister highlighted the importance of the lockdown and adherence to social distancing in saving people's lives. He underlined that the motto of the government earlier was Jaan hai to jahan hai, but now is Jaan bhi, jahan bhi. He observed that the combined effort of the centre and states has reduced the impact of COVID-19, but since the situation is rapidly evolving, constant vigilance is paramount. He emphasized the criticality of the coming 3 to 4 weeks in determining the impact of the virus. Prime Minister categorically assured that India has adequate supplies of essential medicines. He added that measures are being taken to ensure availability of protective gear and critical equipment for all frontline workers. He also gave a stern message against black marketing and hoarding. Condemning and expressing distress at the instances of attacks on the doctors and medical staff and at incidents of misbehavior with students from northeastern Kashmir, Prime Minister underlined that such cases need to be dealt with firmly. Prime Minister talked about strengthening healthcare infrastructure and reaching out to patients through telemedicine. He also suggested that direct marketing for farm produce can be incentivized to prevent crowding in mandis, for which model APMC law should be reformed. The Prime Minister also spoke about popularizing the Arogya Setu app to ensure downloads in greater numbers. He also referred to the possibility of the app being an e-pass which could subsequently facilitate travel from one place to another. Talking about the economic challenges, Prime Minister said that the crisis is an opportunity to become self-reliant. During the conference, the chief ministers provided feedback about the COVID-positive cases in their respective states. They also discussed steps taken to maintain social distancing, ramp up healthcare infrastructure, mitigate difficulties of migrants, and maintain supply of essentials. 1,035 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the country in the last 24 hours, taking the total number to 7,447. Out of these, 642 patients have recovered and discharged from the hospitals, while 239 patients have died. Briefing media in New Delhi, Joint Secretary, Ministry of Health and Family Welfare, Love Agarwal said, India's response to contain COVID-19 has been proactive and it has followed a graded approach. He said in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits and ventilators, and dedicated COVID hospitals are also being set up to provide proper treatment. Mr. Agarwal informed that as of now, 586 dedicated COVID-19 hospitals have been set up with a capacity of more than 1 lakh isolation beds. He said this figure is being augmented every day based on the evolving situation.
586 डेडिकेटेड हॉस्पिटल स्टेट ने हमें रिपोर्ट किए हैं, गवर्नमेंट ऑफ इंडिया और स्टेट गवर्नमेंट ने मिलाकर, जिसके द्वारा करीब 1 लाख प्लस बेड्स, आइसोलेशन बेड्स और करीब 11,500 जो उसमें आईसीयू बेड्स भी उन्होंने प्रिपेयर किए हैं. फिगर दिन प्रतिदिन हम बढ़ाते जा रहे हैं डिपेंडिंग ऑन सिचुएशन, डिपेंडिंग ऑन इवेंचुअलिटी.
Mr. Agarwal said Ministry of Ayush has prepared a set of guidelines on respiratory health and to boost immunity. Mr. Agarwal said that the lockdown and containment measures are important to fight COVID-19. If we had not taken any measures, then we might have had 2 lakh cases at this time.
हमारी ट्विन स्ट्रैटेजी है, एक तरफ हम सोशल डिस्टेंसिंग और लॉकडाउन को प्रमोट करें और दूसरी तरफ हम कंटेनमेंट मेजर्स पे भी अपना काम करें। दोनों मेजर्स को जब हमने 25 मार्च से लेना शुरू किया है तो हम लोगों ने देखा है कि केसेस में काफी कमी महसूस की गई है। आज के इस एनालिसिस को एक्स्ट्रापोलेट करके समझें तो आज जब हमारे पास 7,447 केसेज हैं तो शायद लॉकडाउन नहीं होता और हम उसी रेट ऑफ ग्रोथ ऑफ केसेज से जूझ रहे होते तो हमारे शायद 45,000 केसेज हुए होते। अगर हम कोई भी मेजर न लेते तो शायद हम 2 लाख केसेज आज इस टाइम हम लोग ऑब्जर्व कर चुके होते।
Joint Secretary in the Home Ministry, Punya Salila Srivastav, said that Ministry of Home Affairs in a letter today requested the states to provide police security to doctors and other medical staff as needed in the hospitals as well as the quarantine facilities where they are working.
आज गृह मंत्रालय ने स्टेट्स और यूटीज को पत्र लिखकर फिर से आग्रह किया है कि डॉक्टर्स एवं मेडिकल स्टाफ को आवश्यकता अनुसार पुलिस सिक्योरिटी दे अस्पतालों में जब वे स्क्रीनिंग हेतु जाते हैं और जहां पेशेंट्स क्वारंटाइंड हैं।
ICMR head scientist Dr. Raman Gangakherkar said that we have tested 1,71,718 samples so far, out of which 16,564 samples were tested yesterday. He said 146 labs are functional under ICMR network, while 67 labs are in the private sector.
Employees Provident Fund Organization EPFO has settled 1.37 lakh Provident Fund withdrawal claims worth 280 crore rupees to provide relief to subscribers during the lockdown. The amount was disbursed under a new provision specially formulated by amending the EPF scheme to help subscribers fight COVID-19. EPFO has settled these claims in the past 10 days. It has also put in place an electronic mechanism for crediting EPF and EPS accounts of its subscribers as per the relief package under PM Garib Kalyan Yojana last month. India is the largest producer and exporter of hydroxychloroquine with 70% of annual global production. Department of Pharmaceuticals has said that there is enough stock of API and manufacturing capacity of hydroxychloroquine formulations to meet the country's requirements as well as export obligations. Meanwhile, senior scientists at ICMR told media in New Delhi today that the use of hydroxychloroquine is as prophylaxis and not as treatment. He said it was never recommended for the general public. As part of a Mythbusters and Fact Check series, we bring our listeners information on hydroxychloroquine. Speaking to All India Radio, Dr. Mohan Rao spoke on the role of the drug in containing COVID-19.
Chloroquine is not good. It's not safe to use. Particularly persons who have some heart problems, other problems, it should not be used. It should be used only when doctor prescribes as an adjuvant. This plus other medicines, and doctor only will decide whether this is good for a patient or not. If anybody and everybody just like that takes this medicine, it can be dangerous. So please don't use it as a tablet, as aspirin or some such thing.
Lieutenant General Dr. Ved Chaturvedi said that the hydroxychloroquine is not meant for universal use.
आज इस कोरोना वायरस का कोई इलाज नहीं है, बट हमें ये मालूम है कि कई चीजें फायदा पहुंचा सकती हैं, जैसे हाइड्रोक्सीक्लोरोक्विन, 60% इन्फेक्टिविटी रेट कम हो सकती है, जो पेशेंट के लंग्स कॉम्प्लिकेशन है वो कम हो सकते हैं, जिसको हम कहते हैं थर्ड स्टेज, जब आपके बहुत से ऑर्गन्स फेल होने लगते हैं, जिसको बोलते हैं साइटोकाइन स्टॉर्म हमारे भाषा में, तो स्टेज 3 को ये प्रिवेंट कर सकता है.
Indian Railways has distributed over 1 million free hot-cooked meal to the needy people during the ongoing lockdown due to the COVID-19 outbreak. The food distribution is being done to the poor, children, coolies, migrant laborers, stranded persons, and whoever else comes in search of food at and near the railway stations and even at some distances away from the railway stations. While delivering the food to the needy people, social distancing and hygiene is being observed. The bulk cooked food is being provided with paper plates for lunch and food packets for dinner through IRCTC-based kitchens, RPF resources and contribution of NGOs across the country. Principal Scientific Advisor to the Government of India, Dr. K. Vijay Raghavan has said wearing masks is better than not wearing any masks to protect oneself from COVID-19. Talking exclusively to AIR News, Dr. Vijay Raghavan stressed on the importance of covering one's mouth and nose when in public. He said people must not use masks in a way that causes a short supply to the frontline health workers, but opt for homemade reusable face covers that are thoroughly cleaned.
It is better to have a face cover than to cough into your elbow or into your hand, number one. Secondly, keep in mind that asymptomatic people can be transmitted. Therefore, they can transmit even when they are not coughing. Therefore, covering your mouth and nose is important in public so that supposing you are asymptomatic, you don't transmit. We don't know yet what are the mechanisms of transmitting, whether it's only by droplets in coughing or sneezing, or whether there are other modes of transportation. And thirdly, face covers are used by frontline hospital workers because they want to protect themselves.
Dr. Raghavan said Arogya Setu mobile app is an important weapon in the fight against COVID-19. He said the app is very valuable because it combines contact tracing with a link towards testing.
People across the country are following government's appeal to stay in their homes during the lockdown period. We spoke to a cross-section of people who share their views on lockdown and how they are utilizing their time during this period.
I, Sirim Prakash from Patna, Bihar. This year I appeared in class 12th board exam. I would like to appreciate the decision of lockdown by our Prime Minister Shri Narendra Modi ji. I am spending quality time with my family. I am learning basic cooking from my mother and also taking interest in household activities which will be helpful in my future. In today's busy life, we are not getting this much of time to learn all these activities. I request to all the citizens of my country to stay at home and stay safe.
This is Ritika from Lilua, Havra. I think this is the time when we all should maintain social distancing by staying at home. Owing responsibilities towards society during community assistance amidst crisis of COVID-19, I have distributed food and sanitation items nearby my society. We, the citizen of India, must follow all the guidelines issued by the government time to time.
People who are stepping out of their homes for providing essential services are taking all necessary precautions.
My name is Urvashi Sehgal, a banker by profession, posted in Kanpur region. Recently married. My husband is also a banker who is posted in Chitrakoot. In this time of pandemic, we are serving the nation by performing our official duties, by serving our profession. Kindly stay home and stay safe because we are out for you.
Ordnance Factory Board of Defence Ministry is playing an important role in the fight against COVID-19. Defence Ministry said in a release that the board has designed cost-effective isolation wards with 2-bed tents fully equipped with medical facilities for screening, isolation and quarantine. These special tents can be used for medical emergency and are made of waterproof fabric, mild steel and aluminium alloy. These tents can be set up in any place and terrain and help in creating additional facilities other than those in conventional hospitals within a short period of time. Ordnance Equipment Factory Kanpur has manufactured these tents. 50 such tents have been sent to Arunachal Pradesh.
Sri Chitra Tirunal Institute of Medical Sciences and Technology, Kerala, has obtained a go-ahead for taking a bold step to provide innovative treatment to patients suffering from COVID-19 disease. The Thiruvananthapuram-based STTI-MST is an institution of national importance under the Department of Science and Technology, Government of India. Medically termed as convalescent plasma therapy, the treatment aims at using the immune power gained by a recovered person to treat a sick person. ICMR has given the approval to the STTI-MST for carrying out the novel treatment. Before we move on, a reminder of the headlines. Prime Minister Narendra Modi discusses strategy against COVID-19 pandemic with chief ministers. Several states request extending lockdown for 2 more weeks. Jaan Bhi Jahan Bhi is the motto of the government in the fight against COVID-19, says Prime Minister. Adequate supplies of essential items available to citizens assures Prime Minister, talks tough on black marketing and hoarding. Around 32 crore people receive benefits under Pradhan Mantri Garib Kalyan package. Government sets up 586 dedicated COVID-19 hospitals with a capacity of more than 1 lakh isolation beds, and the centres ask states to provide police security to doctors and other medical staff. For quick news updates, round the clock, follow us on Twitter, handle @AIR News Alerts.
The government has provided over 28,000 crore rupees support through direct benefit transfer to around 32 crore beneficiaries under Pradhan Mantri Garib Kalyan Relief Package announced in view of the COVID-19 outbreak. In a tweet, Finance Ministry said around 14,000 crore rupees have been directly transferred to approximately 7 crore farmers under PM Kisan scheme and 10,000 crore rupees to over 19 crore PJMDY women account holders and 3,000 crore rupees to 2 crore building and other construction workers till yesterday. Over 1,400 crore rupees have been transferred in the accounts of around 3 crore Divyang, senior citizens and aged widows as well. Life Insurance Corporation today announced an extension of 30 days for payment of premium due in March and April 2020 to mitigate the hardships being faced by policyholders in the wake of COVID-19. LIC said in a statement in Mumbai that relaxation is allowed up to April 15th for February premiums, where grace period was expiring after March 22nd. It also said that policyholders can pay premiums through LIC's digital payment options without any service charge. Premiums can also be paid by downloading mobile app LIC Pay Direct, it said.
Under exercise NCC Yogdan, around 2,000 NCC volunteer cadets have joined the fight against coronavirus since the 1st of April. These cadets are helping civil administration, defense and police personnel in 12 states and union territories. Requests have come in from states to requisition NCC cadets for various tasks. Around 50,000 cadets have so far volunteered to contribute to exercise NCC Yogdan. The state machinery is ensuring that all the cadets are provided with proper safety equipment like masks, gloves and other precautionary measures during the deployment. Jammu and Kashmir government has made elaborate provision for providing emergency services and care to families and dependents of healthcare personnel associated with the prevention and treatment procedure of COVID-19 infection cases. The target families can use 112 emergency helpline for registering any cry for help. The matter related to children, 112 helpline shall be taken up with Chairperson, Child Welfare Committee, the nodal person for the purpose. In case of emergency, the people can avail free ambulance service 24/7 at their doorsteps by calling on the toll-free number 108. Pregnant women and sick infants can avail free ambulance service by dialing toll-free number 102. The toll-free national helpline number is 1075. The people can also directly write to covidhelpjk@gmail.com in case of any help or emergency. Huge efforts have been made by the government and administration to prevent the spread of corona infection in the rural areas and to provide essentials to the people during lockdown. Our correspondent reports about the health of the people in the rural areas is being monitored.
Rupees 50,000 to Gram Panchayats and rupees 1 lakh have been given to the Panchayat Simitis for security kits, sanitizing work and other needs to deal with COVID-19 situation. MLAs have been empowered to recommend up to rupees 1 lakh for providing masks and sanitizers from their MLA fund and up to 5 lakh rupees for the purchase of medical equipment and materials. People coming from other districts and cities in villages are being identified and quarantined. Quarantine centers have also been identified in Gram Panchayat. Disaster Management Department has formed a core group at the Panchayat headquarters under the chairmanship of principals, which is helping to ensure social distancing and distribution of ration. Ration packets are being distributed to needy families. Teachers and Anganwadi workers have been deployed to maintain social distancing at post offices, banks and ration distribution shops. ANM and ASA Sahyognis are keeping a close watch on the health of people through the door-to-door survey. Jitendra Dwivedi, AIR News, Jaipur.
Meanwhile, the number of corona-positive persons has gone up to 678 in Rajasthan. The highest number of new cases, 117, was reported in a single day today in the state. The walled city area of Jaipur is the most affected due to corona, where 65 new cases were reported today. In Punjab, near Dera Bassi Jawaharpur village of SAS Nagar Mohali has become the hotspot for COVID-19. With 2 more corona-positive cases reported today, the number of COVID-19 patients in Jawaharpur has risen to 34 and 50 in the entire district. District administration has declared Jawaharpur and nearby villages as a containment zone and regular sanitization is being done in the area. In Gujarat, the total number of confirmed cases for COVID-19 reached 432, with 64 new cases being reported in the last 12 hours. State Health Department said 31 new cases were reported in Ahmedabad, 28 from Vadodara, 3 from Anand, and 1 each from Bhavnagar and Surat. Principal Secretary of Health Department Jayanti Ravi said 376 COVID-19 patients are stable, while 3 are on the ventilator. The West Bengal government has announced extension of the ongoing lockdown till the 30th of this month, following the meeting with the Prime Minister. The Chief Ministers also announced suspension of classes in schools, colleges and universities till the 10th of June this year. She informed that another 6 fresh corona-positive cases have been detected in the last 24 hours, taking the total number of patients being treated to 95. In Assam, no new case has been reported in the state during the last 40 hours. So far, 29 positive cases are reported in Assam, while 1 person has lost his life. Joint Secretary in the Finance Department, Kailash Karthik, said that 4,000 people have registered themselves as corona warriors in the state so far. In Andhra Pradesh, the corona-positive cases have jumped up to 405 as on now, with 24 new cases being registered in Guntur, 17, Kurnool 5 and 1 each in YSR, Kadapa and Prakasam districts. Not even a single case has been reported in Srikakulam and Vizianagaram, north coastal districts of Andhra Pradesh, that attracts nation's attention.
In Maharashtra, with 92 more cases of COVID-19, the number of such patients in the state reached 1,666 today. So far, 110 persons have died due to the infection in the state, while as many as 188 patients have been discharged from hospitals after recovery. According to State Health Department, 72 of these new cases were detected in Mumbai. More updates from our Mumbai correspondent.
Maharashtra Chief Minister Uddhav Thackeray has asked people in the state to strictly follow the lockdown guidelines and maintain discipline so as to break the chain of COVID-19, which has severely affected certain localities of Mumbai, Thane, Pune and Navi Mumbai. He said the call to extend the lockdown is being taken to completely break the chain of the virus and win the fight against it. Meanwhile, the district administration in Thane has sealed borders of Ambernath, Badlapur, Murbad and Shahpur towns where some cases of COVID-19 have been reported. Health Minister Rajesh Tope today said that areas in the state will be demarcated into red, orange and green zones. With Kunal Shinde, Nivedita for AIR News, Mumbai.
The Tamil Nadu Cabinet has decided to go with Prime Minister's impending announcement on extending the lockdown. The State Cabinet meet led by Chief Minister Edappadi Palaniswamy was held in the Secretariat at Fort St. George in Chennai this evening. More from our correspondent.
The reason adduced for the State Cabinet's decision to follow the Prime Minister's announcement on the lockdown extension is that the lockdown cannot be effective if it is implemented in just a few regions. Meanwhile, the state has recorded 58 new COVID-19 cases today, taking the total of the infected patients to 969. 1 person in Erode died of the disease, raising the death toll to 10. In another development, the Indian Council for Medical Research has approved 1 more laboratory to test for the SARS-CoV-2 virus that causes the COVID-19 disease. 3 more are expected to be approved very soon, 1 each for Kanyakumari, Vellore and Tanjavur. Jai Singh, AIR News, Chennai.
Kerala is set to become the first state in the country to commence convalescent plasma therapy to treat critically ill COVID-19 cases on a trial basis.
Indian Council of Medical Research has given its note to Kerala for the first of its kind project for the clinical protocol exploring the feasibility of an experimental therapy, convalescent plasma transfusion, which may be administered to severe COVID-19 patients. In this therapy, the blood plasma from individuals who have recovered from COVID-19, that is, their immune system that has developed antibodies in the blood plasma to beat the disease, is transfused into a person critically ill with the disease. The project is initiated by Sri Chitraranal Institute of Medical Science and Technology in Thiruvananthapuram. At present, convalescent plasma therapy is not new and have been used by doctors to treat critically ill patients during earlier epidemics like H1N1, SARS and Ebola. The expert committee which is guiding the state's containment and mitigation strategies against COVID-19 had recommended exploring the plasma therapy following the report in Journal of American Medical Association of a pilot study done by doctors in China. Even as Kerala is successful in flattening the curve of COVID-19 with more recoveries and less cases, if the clinical trial of convalescent plasma therapy becomes successful, it will surely be a major step forward for its fight against COVID-19. Mayusha, Thiruvananthapuram.
A COVID-19 survivor from Meerut spoke about the illness after getting discharged from the hospital. She thanked the doctors for their support.
मैं सबसे ये कहना चाहूँगी कि घर में अच्छे से रहें, कोई बाहर ना निकले और गर्म पानी से जगह सेवन ज़्यादा से ज़्यादा करें और स्टीम लें। और यहाँ टीम ने हमारा बहुत सहयोग किया है, बहुत हेल्प किया है हमारी, किसी चीज़ की हमको परेशानी नहीं है, हर तरीके से हम लोगों ने हमें सपोर्ट किया है, उनको मैं धन्यवाद बोलना चाहूँगी।
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Rakesh Garg of AIIMS said spread of COVID-19 can be contained if people follow the guidelines and take necessary precautions.
The social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
Dr. Sanjay Pandey of GB Pant Hospital said there is no proof in the claims that taking vitamin C will either cure or prevent COVID-19.
विटामिन सी को लेकर इस तरह के दावे किए जा रहे हैं, लेकिन इसमें कोई सच्चाई नहीं है कि विटामिन सी से कोरोना वायरस के ऊपर कोई हम या तो कंट्रोल कर सकते हैं या व्यक्तिगत रूप से किसी को विटामिन सी लेने से उसको कुछ फायदा हो सकता है। हाँ, आप ले सकते हैं विटामिन सी, कोई भी विटामिन ले, खाने पीने में आप जो भी लेना चाहे ले सकते हैं, लेकिन साइंटिफिक एविडेंस विटामिन सी के बारे में भी नहीं है।
For listening to other experts on COVID-19, tune in to our news bulletin. Actress Kriti Sanon appealed to the people to follow lockdown restrictions. She said that India needs to unite to fight the pandemic.
Guys, they're very small, basic things that we all can take care of. If you're stepping out to buy grocery, make sure that you're at least at a 6 feet distance from each other. Do not touch anything, wear a mask. Do not touch your face. Come back, wash your hands for at least 20 seconds. Sanitize everything that you've touched. अगर आप अपनी लिफ्ट में जा रहे हैं तो लिफ्ट का बटन हाथ से नहीं दबाएं, एल्बो से दबाएं. If you're a righty, use your left hand to open all the doors and turn knobs. Stay positive, stay fit, stay at home.
Spiritual leader Sri Ravi Shankar also urged people to stay at home and avoid gathering in crowds.
अभी की परिस्थिति ऐसी है, सब अपने अपने घरों में रहो, एकांत में रहो, ज्यादा भीड़ में ना जाओ। ये प्रकृति के द्वारा दिया हुआ एक मौका है आपको अंतर्मुखी होने के लिए। अंतर्मुखी सदा सुखी। हम अपना थोड़ा सा साधना पर हो जाएं, थोड़ी देर बैठ के ध्यान करना शुरू करें, मौन रखें, ये रोग निरोधक शक्तियों को बढ़ाएं। प्राणायाम, ध्यान, योगासन, ये सब करिए घर में बैठे बैठे।
Carnatic music exponent and playback singer Sudha Raghunathan appealed to the people to install the Arogya Setu app and assist in combating COVID-19.
Once installed on a smartphone through an easy and user-friendly process, the app detects other devices that have the Arogya Setu app via Bluetooth and GPS. The app then calculates the risk of infection based on sophisticated parameters, algorithms, and artificial intelligence to ascertain the risk levels. This app will enable people to assess for themselves if they are at risk of being infected by the COVID-19 virus. In turn, the Arogya Setu app will help the government to take necessary steps in real time for assessing the risk of the spread of the COVID-19 virus.
The global coronavirus death toll crossed 100,000 yesterday. The grim milestone came as the World Health Organization issued a warning that prematurely lifting lockdown restrictions, which have kept more than half the world's population in lockdown, could spark a deadly resurgence of the disease. More than 1.6 million people have been infected around the world, and nearly 70% of the deaths are in hard-hit Europe. And now, before we end, the headlines once again. Prime Minister Narendra Modi discusses strategy against COVID-19 pandemic with chief ministers several states request extending lockdown for 2 more weeks. Jaan Bhi, Jahan Bhi is the motto of government in the fight against COVID-19, says Prime Minister. Adequate supplies of essential items available to citizens, assures Prime Minister, talks tough on black marketing and hoarding. Around 32 crore people receive benefits under Pradhan Mantri Garib Kalyan package. Government sets up 586 dedicated COVID-19 hospitals with capacity of more than 1 lakh isolation beds. And Centre asks states to provide police security to doctors and other medical staff. And with that, we end the special news program on COVID-19.